All right, so let's start this broadcast with the big story that has come in from the United Kingdom, where according to reports, there appears to be no end to the strikes and other financial woes for the United Kingdom this Christmas season. In the latest, nearly about 100,000 nurses who work for the NHS in England, Wales and Northern Ireland have staged a day-long strike. This is the second strike by the nurses in a span of a week. The strike has come as the health workers are demanding for what they say is inflation-busting pay increase to make up for years of real-term salary cuts. The nurses have said that due to their low salaries, many of the nursing staff are quitting the profession altogether, leaving them severely understaffed in hospitals, resulting in most of them being overworked and underpaid. They also say that this has compromised the quality of care that is offered to the patients in the hospitals. So look at some of these visuals that have come in from the London hospital, where a mother and a young child confronted the British Health Secretary.
I would love it if you were the government, because I am so scared about my daughter's future, thinking about what you guys might do for the NHS and what that means in exact terms for the length of her life, because if you don't prioritise the NHS, I don't know what chance she has at a longer life.
Well, part of the reason we put the extra money in the autumn statement is to prioritise that extra expensive billion and the biggest level increase in.
This is what this mother had to say to the British Health Secretary Steve Barclay, where she made it abundantly clear that looking at the kind of service that is on offer in the government hospitals, she said that the government is not prioritising the healthcare staff, which is resulting in poor service being offered to all those patients who are ailing, who've got to wait for months on end sometimes to in fact get the medical assistance that they sometimes need.
There was no bed despite her incredible CFT doing everything they could.
Yes.
And then they pulled loads of strings, and a few days later we got a bed. So she's had a bronchoscopy.
The nursing union's chief has also issued an ultimatum to the British Prime Minister Rishi Sunak as nurses walked out over pay and staffing shortages. They're also trying to pile pressure on the ministries, and they want the government to act, and to act now. They've said that their salaries simply haven't risen for years, and that is the reason why they're out on the streets.
I've said time and time again, I won't dig in if they won't dig in, but they need to find a room and bring me into it. I'm looking for that room every single hour of the day. I will not be found wanting in getting into that room, and I will be available night or day to do that. He can bring this strike to a conclusion before the end of this week. He owes that to this profession. He owes it to every member of the public in the country.
Now remember, the nurses in Britain had staged the biggest ever strike in the history of NHS last week. About 10,000 staff were absent on Thursday, and about 16,000 appointments and surgeries had to be rescheduled in England alone. Now, Tuesday's 12-hour walkout is likely to cause similar disruptions, although services such as urgent cancer care will continue.
I think the Health Secretary needs to honour his commitment to patient safety, and that means patient safety every single day and every single shift. Patient safety is at risk every single day because of short staffing numbers, not just within nursing, but within the ambulance service, within allied healthcare professionals, with our doctors. So this is a wide systemic issue, and the government need to look at how they properly train, fund and retain our staff.
Let's turn our gaze to China. As we reported
The season of strikes
COVID
does not
cases
end
are
here.
on the rise.
Ambulance
On
workers,
Monday,
including
China reported more
paramedics
than
and also call
20,000
handlers, are also
cases.
set to strike on Wednesday,
The numbers are
while a
approaching
second
the
such
daily
walkout
peak
is
from
scheduled for the
April this
28th of December. A
Beijing
bigger
saw its
healthcare
highest
crisis
number of
also
COVID
looms.
cases.
The government has maintained that the nurses' demands are
1,438
simply
cases were reported
unaffordable,
in the Chinese
and that the
capital.
recommendation of an
Now, it may not
independent
seem
pay
like
review
much for a
body
city of
in
more
setting
than
wages have
21
been
million
followed.
residents, but this is a pandemic record. China has reported only 5,229 COVID deaths till date. 3 of those came.
WION is now available in your country. Download the app now and get all the news on the move.